Hey everybody, and welcome to the Parkinson's Disease Education channel, where we attempt to demystify the disease and to empower you as the person with Parkinson's to reach your true potential. This is going to be a little bit of a different video, as I am starting to do reactions, or essentially videos with commentary on the channel. I'd like to try it for a while and see how you like it, and I'd love to hear your feedback. This is going to be about topics related to Parkinson's disease, obviously. And I thought I'd start with a short video that I discovered a few days ago. There's a PT colleague of mine, Dr. Jimmy McKay, and I've been connected with him online for quite a while. But he has a YouTube channel and podcast called the PT Pintcast. Essentially, it's a podcast for physical therapists and physical therapist students. And in the videos that he does, in the podcast that he does, he essentially interviews other therapists. But some of the shorter form videos he's doing are for preparation for the National Physical Therapy Examination. So I thought I'd give you a little bit of background before we go into the video on what that is. So the NPTE in the United States of America, we have a board exam, a singular board exam that basically, once we pass that, allows us to apply for a licensure in any state in the United States of America. That's our baseline minimum that we have to have, is the national board exam. So there's not a board exam for each state. It's a national board exam that gives us the ability to be eligible for licensure in any state. So that being said, there are, just a really brief summary of the exam. There are 5 banks of 50 questions. So it's a 250 question test. And among those 5 banks of 50, there are topics that basically, it could be about anything that we learned in our time in the doctoral program. So obviously preparation takes some work, and it's a little bit of a nail biter, but once you pass it, you're done forever. So it's kind of an amazing feeling, and I passed the first time, and I can't tell you the relief. And that's a few hours of my life that I don't really remember very well, but it was worth the effort because I'm here. But it's been 11 years since I've taken the board now. Anyway, going back into Jimmy's video, I thought this was a really intriguing video. You're probably wondering, why in the world are we talking about this on this channel? Well, he talks about board questions that relate to Parkinson's disease, and he looks at 2 different questions from the board and does essentially a little pop quiz on the video, and talks about the answers and why they're the most appropriate answer. So I thought this was great that another physical therapist in the profession is bringing up the topic of Parkinson's disease, and they actually have questions on the board exam about Parkinson's. So I thought it would be nice for you to know that. So most physical therapists, even if they don't specialize in Parkinson's, should at least have a basic knowledge of treatment of Parkinson's in terms of the therapy world. And anyway, we're going to go into the commentary without further ado. And so I don't necessarily want to give you a whole background on Jimmy, Dr. McKay at this point. You can look him up on the website, the ptpintcast.com, I believe it is, or the YouTube channel, PT Pintcast. But we're going to go right into it, and I'm going to put my headphones on so that I can hear the video and pause with some commentary in there. Full disclosure, this is not the first time I've seen this video now, because I did a recording of a reaction that didn't go very well, but I wanted to do it over to be a little bit better quality for you and for the audience on the channel. So here we go. I'm going to put my headphones on, and we're going to share screen, and you'll be able to hear the video and see the video along with me. And play.
So it explores a medical condition that's crucial to know inside and out, not just for acing the NPTE, but also for making a meaningful difference in clinical practice and everyday life. Physical therapists are uniquely skilled to tackle this condition, and knowing it well sets you up for excellence in both your exams and real-world interventions. Welcome back to the NPTE StudyCast, your indispensable guide for mastering the NPTE. Today, we're unraveling the intricacies of Parkinson's disease. You can't afford to miss this, so let's dive in, and don't forget to click subscribe. All right, so what is Parkinson's disease? Follow me. Imagine your brain is a bustling city. Substantia nigra, This causes a neurodegenerative traffic jam, meaning it's a slow decay of nerve cells in the brain.
Yep.
Dopamine, the brain's VIP currency for smooth, controlled movements, is getting stolen right from the bank vault. Now, what's the fallout?
I just want to pause and say that is a really good summary of what Parkinson's disease is. I love the analogy he uses of a superhighway, and there's a roadblock in the substantia nigra because those cells, those neurons that produce dopamine, are dying. So he does a really great way of summarizing this, not only for persons with Parkinson's, but for student physical therapists who are preparing for the board. So it's a nice overview.
A city, your brain, struggling with movement and coordination. So what causes Parkinson's disease? If that substantia nigra we mentioned is the highway, what puts the roadblock there? Well, good question. It's like asking why there's traffic on a Monday morning. Could be a lot of reasons, often all at once. Genetics, environmental toxins,
Sorry, my chair's making noise.
It's a mix of elements, a cocktail of culprits, if you will. The symptoms of Parkinson's disease are like the dashboard warning lights of your body. You've got motor symptoms and non-motor symptoms. Now, on the motor side, we have tremors, which are like your body's unwelcome vibration feature. Then there's bradykinesia. Think of that as your internal motor running low on battery. Rigidity, that's your muscles acting like they're in a never-ending flexing contest. And let's not forget about postural instability. It's like trying to balance a book on your head while walking on a tightrope. Now, on the non-motor side, expect issues like depression and even sleep disturbances. This thing is a full body affair. Now, what can PTs do
This thing is a
about it?
full body affair. Absolutely 100% knocked out of the park with that comment. And I think it's also important to note briefly that while he didn't go into nearly any, he went into 2 or 3 of non-motor symptoms, and there's a huge list of them. So obviously for this video, he's not going to go into all those details. But he did a great job of summarizing the motor symptoms of Parkinson's disease, and also hinting at the fact that this affects the whole body and virtually all systems of the body. So that was a job well done and a short little nugget that he gave there.
This is where you come in, future PTs. Imagine you're a traffic engineer, a choreographer, and a coach, all rolled into one. You're not just directing the flow, you're refining the moves. Exercise programs, balance training, and techniques to unfreeze gait are all tools in your multifaceted toolbox.
Right.
Let's take a question from one of you in the audience. This one's from Mike from the PT program at USC. Mike says, I'm curious about these unfreezing gait techniques. How can we help get our patients get their groove back? Mike, excellent question. We want you to think of gait freezing like a buffering video. To get it playing smoothly again, let's try tactics like marching in place. It's like hitting the refresh button on that frozen browser. It gets the brain's attention and often gets your patient moving again. Mike, thanks again for asking that question.
And again, there's multiple ways to break out of freezing episodes, but marching in place certainly is one of them. And I've found that to work pretty well in clinical practice. Anyway, that's great. Let's move on.
Here's your first mock NPTE question. A patient with Parkinson's disease has been referred to physical therapy due to shuffling gait. Which of the following is the most effective cueing strategy for improving gait in such a patient? Option 1, auditory cues. Option 2, visual cues. Option 3, tactile cues. Or option 4, no cueing is effective.
Okay, so we have 4 choices on a multiple choice question. For improving someone that's walking or gait with Parkinson's, what is the most effective cueing technique? So you've got auditory cues, meaning something like a metronome or snapping your fingers, something like that, or music, a song with a beat. 2, you have visual cues, so that might be marks on the floor, it might be modeling the therapist, etc. And then he said tactile cues, which would be the therapist facilitating or helping them to move the leg through bigger with walking. And then the last answer was no cueing at all, or none as effective. So for the purposes of this question, they're looking for B, or visual cues, because those tend to be a stimulus or a cue that is very effective in Parkinson's disease, more so than auditory cues for sure. Auditory cues are often talked about. You'll often find devices with metronomes and things like that. I personally haven't found those very effective in practice, more so than the visual cues. Those certainly do. So that's going to be your answer.
I'll give you a second to think about those. All right, here goes. The answer to that question is visual cues are the most effective. Research indicates that patients with Parkinson's disease respond well to visual cues, such as lines on the floor, when it comes to improving gait. Let's jump into another module.
And one more thing I was going to add on visual cues. I alluded to modeling the therapist. So in programs like LSVT Big, it's heavily based on modeling the therapist, displaying big movements to the patient, and giving them a verbal cue to move as big as I'm moving, do exactly what I do, and then backing that up with tactile cues. So LSVT Big is a combination of different cues, but primarily visual cues is what we're using in that technique. So it definitely bears out in clinical practice.
NPTE question. Here goes. A physical therapist is working on postural stability with a patient suffering from Parkinson's disease. Which of the following exercises is least effective for this goal? Here are your options. Sit to stand exercises, Tai Chi, leg curls, or balance exercises on an unstable surface. Think about those options for a second. I'll wait.
Most definitely going to be leg curls as the least effective. I don't know if you can hear me. Leg curls are definitely the least effective.
Now, which of those exercises was least effective for your goal? Leg curls are the least effective at achieving your goal. Now, while they may improve hamstring strength, they're not specifically aimed at improving postural stability in patients with Parkinson's disease.
Right.
I hope this video was effective for you to get a little bit more understanding on the intricacies of Parkinson's disease. Take that information you learned today with you on exam day. If you liked what you heard here, don't forget to click subscribe.
Okay. Well, as you can tell, for some reason my video feed decided to stop right in the middle of the reaction video. The audio is still there for what it's worth, but just wanted to say thank you to Jimmy, Dr. McKay, for this great video. I hope that you put out more material like this. I think that it's great that we have therapists out there that are thinking about things like helping students to prepare for board examination, especially bringing things like Parkinson's disease to light. And I love that he said that it's crucial to understand this disease because it's something that you're going to see a lot out in the field. Whether you work in an outpatient setting or a hospital, basically anywhere where you see clients, patients, you're going to see Parkinson's disease. So I applaud Jimmy McKay, Dr. McKay, for doing that. And you may not be interested because you're not physical therapists watching this, but I hope you will check out some other videos on his channel, PT Pintcast, and I'll put a link to that in the description. I hope you enjoyed this video, and I hope you enjoy the reactions that we're going to do. I'm sorry about the technical issues in this video. I do apologize for that. And I didn't realize until I was actually proofing and editing this video that my recorded video with my face on it just stopped. But the commentary is still there, so I'm not too sad, but I do apologize for that. I'm going to see if I can work those kinks out for the next one. I'm not going to keep you any longer. Please don't forget to subscribe, like this video if you enjoyed it. Leave your comments letting me know what kind of reactions you'd like to see. If you want my take on specific interviews or specific films or videos about Parkinson's disease, I would be more than happy to do that and to share it with you here on the channel with my thoughts. With that said, be empowered. I'll catch you in the next one.